welcome back to my channel. In today's video, I want to talk about arthritis being featured in television shows, but not just any TV show. I recently came across a post someone made in the arthritis community, another advocate, who saw an episode of Chicago Med. The show is in their 7th season right now, so you can assume that they are doing pretty well. In this particular scene that I'm going to show you guys right now, a mom and her daughter, who was a little girl, came into the ER because the little girl was having health complications, and it ended up being sickle cell that wasn't treated properly. And then the mom started having some visible signs of not doing well, and the ER doctors kind of found out what was going on with her and how she was poor and living out of her car, which affected obviously her health and her daughter's health. And we all know that when you don't have proper health care, you don't have access to resources or insurance or whatnot, that can affect a lot of things. So people watching this show, they're going to now keep thinking that, yeah, you are too young to have this disease. This is a random thought, but people attach ages to a bunch of things, and I'm not sure why. Whether that is you are too young to have a child, you're too old to have a child, you're too old to get married or go back to school. Everyone associates age with why you can't do something or why you can't have something happen to you. Now, before I get into what my perspective is on people saying you are too young for arthritis, I wanted to open up the conversations and ask if you guys feel some type of way when people tell you that you are too young for arthritis, if in the past you did, but now you don't really care. I feel that the writers could have done a lot better when it came to representing those with arthritis. There is a level of research that should be done when it comes to medical TV shows. They do a bad job explaining what kind of arthritis she even has. There are over 100 different kinds of arthritis and related conditions, so it would be nice to actually have a real diagnosis rather than just an overarching theme of arthritis, because if you guys watching don't know, arthritis is an umbrella term for all these different types of conditions, ranging from rheumatoid arthritis, osteoarthritis, juvenile arthritis, gout. There's so many types of arthritis, and they just put up an x-ray of her knees, which I really liked how they had the x-ray machine right there. And I know ERs are supposed to have that type of technology, but I feel that they should have that at doctor's offices too, so we don't have to make an extra appointment for x-rays. Second, I have to give big props to those actors. That woman did an amazing job showing how arthritis can be and how painful it can be. Coming from a person who lives with it, I felt she really did have arthritis. So there, she did a good job. The writers, not so much. The third thing is my opinion about the phrase, "you are too young for arthritis." I am a young face of arthritis. That's just the reality. And I feel it's different to say I'm a young face of arthritis rather than someone telling me I'm too young for arthritis. And actually, I have a friend in the arthritis community, Stephanie, who has a blog called The Young Face of Arthritis. She sent me this adorable card. I have to show you guys because it's so cute. And this is her logo, and she sent me these stickers. I didn't ever really picture my life like I have it now. When I was 18, I didn't think that I was going to live the rest of my teens, all of my 20s, and all of my mid-30s with arthritis. And so, yeah, I am a young face of arthritis. And at this point in my life, I am owning the fact that I am a young person with arthritis. Am I too young for it though? No, because again, anyone can get it at any age. So it's just two different ways of going about the phrase and explaining it. And I feel that when you can just look at your life and realize that it doesn't really matter what age you are that you have arthritis, that you can thrive a little bit better too. It doesn't bring you down as much. And it brings me to my point of when you go to the doctor, right? And you're having these weird symptoms, joint pain, muscle aches, fatigue, and you just don't know what's wrong, but you know something's wrong. You bring it up to your general physician and you tell them, "I think I may have arthritis." And they look at you and they say, "No, you're too young for that." Well, then what happens to that person when they go home? They're kind of dismissed as having good health, and they're going through growing pains, which was told to me, and they go weeks, months, years still experiencing these things on and off, and they go back to the doctor and they tell them, "I'm still having these weird symptoms. I don't know what this is, but I know it's something, and I really think it's arthritis." And the doctor looks at them and they see that something is not quite right, because we know that arthritis can be invisible, quote unquote, or visible. And when we say it's invisible, oftentimes people can't see what's going on in the inside. When it starts turning visible though, that's when the doctors are like, "Oh shit, she does have arthritis." And what do they say then? After you go see a specialist and you get diagnosed, a lot of doctors or people in your life may say, "Oh, you poor thing, you're so young for this." What do you want someone who just got diagnosed to do with that information? It does not help them. But what can help someone though? And that is telling them the actionable steps they can take. What medication can I take? What alternative functional therapy medications or therapies could I do? What can I do to avoid side effects or lessen side effects? What can I do to not have a hard road ahead of me? And I mean, I was told by doctors, "Oh, you're so young for this, you poor thing. Like, you're going to have a long journey ahead of you. You're going to probably die by this age." Like, infuse some type of actionable step that is positive. And in the episode here, that doctor, she did show concern and care, and she didn't say anything else that was wrong, but she gave actionable steps for that person. She made that person feel that there was a possible answer for her out there, you know. And a lot of doctors do not do that though. They make you feel that you won't ever get better, you're doomed for life, and your life is over. You need to be careful how you speak to a person, especially if you're a medical provider and you're listening to this video and you have had a tendency to speak like this. Start changing your ways now, because that's not a way to make someone feel comfortable or safe or heard or seen and validated, and all those things that patients need when they have a doctor-patient relationship. And I just want to say that versus arthritis, they came out with a campaign actually, and I have it here. It says, "The Painful Truth, a campaign to get TV and films to show the reality of chronic pain." Arthritis is hugely associated with chronic pain, and this woman who was the actress, I don't know her name, did an amazing job showing the amount of pain that she was in, but it's more based for people in the UK. But hey, if we can target one part of the country, then we can then hopefully cause a ripple effect to go across the pond and around the world, and have media and movies, TV shows, and the people who work for those to do a better job when it comes to representing a bunch of health conditions. All right, guys, that's all I had for this video. Let me know in the comments below what your thoughts are. If you agree with me, if you don't, give this video a thumbs up, thumbs down. Doesn't matter. We are all entitled to our own opinions. And also, the writers should really check out my recent video that I did, shining a light on life with arthritis and invisible disabilities during the COVID-19 pandemic. You will see a lot of people who are quote unquote too young for arthritis. So arthritis doesn't care what age you are. It doesn't care about pretty much anything. And I'll see you guys next time. Before I go, I want to announce the Spoonie Star Supporter of the Week. Here they are. Thank you guys so much for your love and your support. As always, if you want to be my next shout out at the end of my next video, all you gotta do is stay active on my Instagram or YouTube, and I pick someone at random all the time. Again, thank you guys so much for watching and being here. Until next time, bye.